Hi, I'm Dr. Steve Lober, and this is Amy Clark, our CRNA at Stephen Lober Plastic Surgery Center. Our goal at our surgery center is to provide patients with an optimal surgical experience looking at both the pre-op, surgical, and post-op periods. The pre-op phase involves looking at the patient's prior surgical history. Glucose levels need to be optimized if they have problems with glucose intolerance or diabetes. We check albumin levels, especially on patients on GLP-1s who tend to be slightly malnourished, and that inhibits wound healing.
We have good news for you. You will be allowed to have an electrolyte drink mix the night before your procedure and the morning of your procedure. And we will go over with you during your pre-op assessment the timing of this beverage depending on the time of your procedure.
Adequate hydration is essential leading up to the surgical procedure itself. Once again, we found out that patients on GLP-1s are often dehydrated going into surgery. They're not only not eating, but they're not drinking as well. And we tend to have them stop their GLP-1s not 1 week before surgery, but 3 to 4 weeks prior to surgery to make them more nutritionally replete and hydrated. If they're smoking, they need to stop at least 4 to 6 weeks prior to surgery, and quite honestly, for good, for their own sake.
During the operative phase, there are a number of important things that can be done to enhance the patient's surgical experience.
Our circulating nurse, Jenny, has made sure that our operating room is nice and warm. A warming blanket has been placed on the patient to keep their core temperature normal and to prevent infection. Sequential compression devices are also utilized on all patients to minimize venous stasis and prevent blood clots from forming. And hydration continues to be important. We continue IV fluids here with the patient during the surgical procedure.
Finally, we like our patients to wake up comfortably and relatively pain-free, so all patients receive injections of long-acting anesthetics at and around their surgical sites. And all abdominoplasty patients receive injections of Exparel that can provide prolonged pain relief for up to 3 to 4 days.
During the postoperative phase, we continue with our obsession with hydration.
Patients are sent home with electrolyte beverages to start rehydration immediately.
And patients are encouraged to ambulate as soon as possible.
To figuratively and literally get them back up on their feet again.
Again, our overall goal is to make patients as healthy as possible before, during, and after surgery here at Stephen Lober Plastic Surgery.